Hello and welcome. My name is Evelyn Fuertes, and I am a community cancer control specialist at the Rutgers Cancer Institute of New Jersey. I want to thank you for taking the time out of your day for this lecture. I know cancer can be a scary topic. My goal is to give you a better understanding of cancer, how it starts, and how you can protect yourself and your family. Today, we'll be talking about the basics of cancer, what it is, causes, and treatment. We will also review screening for a few common cancers and discuss where in the cancer trajectory screening is most important and why. Finally, we will talk about what lifestyle factors affect cancer risks and what changes you can do to help reduce your risk for certain cancers. In this section, we will review what cancer is and isn't, what are some of the causes of cancer, how it develops and survives, what the difference is between a benign and malignant tumor, what metastasis is, and treatment options available. What is cancer? There is no one cancer. Think of it as a collection of related diseases that can start anywhere in the body. What we know is that normal cells die when they're damaged or old. Cancer cells don't die when they should, and by continuously forming and growing, they can create tumors. Most cancers do form solid tumors. Why do we care about cancer? We care because New Jersey has some of the highest incidence rates of cancer in the country. In a 2014 report, the New Jersey incidence rates for all cancers combined continued to be higher than the US rates. And in the state of New Jersey, we saw over a quarter million new cases of cancer in a 4 year period and over 80,000 deaths. To give you some perspective, it would be like losing all of Trenton's population, which in 2017 was 83,000 people. There are various causes of cancer, and some factors put us at an increased risk. These include familial risks, chemical exposure, sunlight and tanning beds, certain viral and bacterial infections, smoking, and sometimes cells just don't divide properly. In all instances, the major driver that turn normal cells into cancer cells are changes that happen at the genetic level. The next few slides will differentiate between hereditary or familial risk factors and sporadic risk factors. There are two types of risk factors when we talk about cancer risk. Hereditary risk factors are passed down from your parents and may be passed to your children. You can't prevent these genetic changes, but you can understand what cancers you may be at a higher risk for. Sporadic risk factors occur over the course of a person's life and can increase cancer risk. Some of these are called modifiable factors because you have the ability to avoid or change certain behaviors that create increased risks. For example, smoking. An example of a non modifiable risk is aging, which is a major risk factor that can't be changed. You can use genetic testing services to find out if you carry a gene mutation. This will show you what cancers you may be at a higher risk of developing. While it's not always possible, it is important to know your family history. And I just want to point out that hereditary cancers account for about 10% of all cancer cases. Oftentimes, people believe that cancer runs in a family. And as we noted, in a small number of cases, heredity does play a major role. The cause of cancer is more likely to be due to sharing certain sporadic or modifiable risk factors, like learned behaviors, instead of being hereditary. These behaviors lead to genetic changes that over time lead to the development of cancer, and this can usually take years to happen. Since cancer takes years to develop, we consider cancer development as the three phases of carcinogenesis. This is a fancy way of saying when normal cells are transformed into cancer cells. These phases include initiation, which are the first cells to mutate. Promotion is the proliferation of the cancer cells, and it's during this phase that we screen for cancer prevention. Here's where we're doing mammograms, pap smears, and looking for abnormal cells. Cancer prevention activities can prevent and detect cancers early. Progression is the last phase in tumor growth, and this is when the tumor becomes more invasive and aggressive and can metastasize. Cancer prevention runs through the initiation and promotion phases. This is when cancer screening is the most effective at helping to contain and prevent the cancer from spreading. And because it does happen over time, cancer and tumor development is defined in stages. Here is a very basic overview of the stages of cancer. In stage 0, abnormal cells have been found, but since they haven't spread to other tissues, they're not considered cancer. In stages 1 to 3, cancer's been diagnosed. That number represents the size of the tumor and if it has spread to nearby tissue, for example, from your finger to the palm of your hand. In stage 4, the cancer has metastasized. This means that it has spread to other parts of the body, including faraway parts of the body, like breast cancer spreading to a leg bone. Like I mentioned in the previous slide, we want screening to take place before and during stage 0 in order to catch the cancer before it develops. Now that we know how cancer cells develop, let's talk about how they survive. These are the characteristics of cancer cells that allow them to go undetected in the body and evade the immune system. Proliferative signaling is an increase in cell growth signals, and by evading growth suppressors, cancer cells can grow without controls. Activating invasion and metastasis is when the cancer cells move to other parts of the body, including distant parts of the body. Think that stage 4 cancer. Enabling replicative immortality basically means that cancer cells can keep making more cells. Inducing angiogenesis means that cancer cells can make new blood vessels, which we will see how in the next slide. And resisting cell death is how the cells continue to survive. The tumor microenvironment is how cancer cells ensure survival. Cancer cells don't have distinct specializations like normal cells do in the tissue that they're developing in. For example, a tumor cell that's growing in the liver doesn't act exactly like a liver cell. However, they do have the ability to create their own microenvironment by influencing surrounding normal cells, molecules, and blood vessels. Remember angiogenesis? What's amazing is that cancer cells can influence normal cells to create blood vessels to supply the tumors with blood, nutrients, and oxygen, which allows them to thrive and grow. Before we go any further, I would like to make a distinction between benign and malignant tumor cells. Benign tumors don't spread and generally don't grow back when removed. While usually harmless, benign tumors can grow quite large and be life threatening if they're in the brain. That's because the brain is a closed cavity and a tumor will press on the sensitive tissue of the brain and cause damage and even death. In other parts of the body, like in the abdomen, tumors have a lot more room to grow because they're less restricted by the soft tissue around them. Cancerous tumors are called malignant and can spread to other tissues in the body. Cancer cells can travel throughout the body via blood and lymph and form tumors in other areas. I use the words metastasizes and metastasis in the cancer development section. Metastatic cancer is cancer that spreads to other parts of the body, including distant parts. This process is called metastasis. Metastatic cancer will be called by the original or primary cancer. For example, in this image, we see that the colon cancer has metastasized to the liver and a lung. This is metastatic colorectal cancer, not liver or lung cancer. Cancer screening is used to detect abnormal cells before they become cancerous. Remember in the cancer development slide where we want to screen people during proliferation? This is when the abnormal cells start growing, and that's because we want to screen before the cancer or tumors develop. And that's my goal for you today, to understand why we screen when we do and what the impacts of screening are in preventing cancer and cancer deaths. Cancer treatment can come in many forms. The treatment types are based on the type of cancer and level of advancement. The most common treatments we see are surgery, radiation therapy, chemotherapy, and immunotherapy. Both surgery and radiation therapy is a treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Both of these are localized treatments. For example, if lung cancer is caught early, thanks to screening, in many cases it can be cured by surgery that removes the tumor. Chemotherapy, which uses drugs to kill cancer cells, and immunotherapy, that helps your immune system to fight cancer, both of these target cells in the whole body. New therapies that we're seeing more of are targeted therapy, which targets the changes in cancer cells that help them grow, divide, and spread. Hormone therapy is used to slow or stop the growth of breast and prostate cancers that use hormones to grow. Stem cell transplants are used to restore blood forming cells in cancer patients who've had theirs destroyed by very high doses of chemotherapy or radiation therapy. Precision medicine, which helps doctors to select treatments that are most likely to help patients based on a genetic understanding of their disease. When I review screening guidelines and types of screening, I want you to really think about this slide and the cancer trajectory. I want you to think about the promotion phase where we're trying to find the abnormal cells before they become cancerous. So every time I mention the cancer trajectory, I want you to think of this slide. In the following slides, I will review screening guidelines and types of cancer screening for breast, cervical, colorectal, lung, and prostate cancers. We want you to have a better understanding of screening. I don't want to just tell you that screening is good for cancer prevention. We all know that screening is good for cancer prevention. I want you to leave here with a clear understanding of why, when, and how cancer screening is most effective. Breast cancer is the second leading cause of cancer death for women. That's why screening is important. The guidelines from the American Cancer Society and the U.S. Preventative Services Task Force differ. However, every 1 to 2 years appears to be the consensus. If someone is under 40 and has a first degree relative with breast cancer or is at a higher risk for a more aggressive form of breast cancer, it may be best to discuss screening frequency with a healthcare provider since it may be more often than the guidelines recommend. Men are also at risk for breast cancer, especially those with a family history of the BRCA2 gene, men with Klinefelter syndrome, and gynecomastia or benign breast growth. Like in women, obesity increases the risk for male breast cancer due to the higher levels of estrogen in the body. A mammogram is the most common form of breast cancer screening. We recommend this type of screening because it has been shown to reduce deaths in women from ages 50 to 69. A mammogram is an x ray that can help find atypical or abnormal cells and tumors that are too small to feel in a manual breast exam. Think about where in the phases of carcinogenesis we are looking when using mammography. While mammography is the gold standard for screening, it does have limitations and there are several factors that can affect the accuracy. These include breast tissue density, the skill of the radiologist, and the size of and where the tumor has formed. MRIs can also be used for breast cancer screening. It's radiation free and can be used for those with a high risk factor. It's also used when there isn't enough breast tissue for mammogram. Other methods that are being studied include breast exams, thermography, which is based on temperature changes in tumors, and tissue sampling. Again, think about where in that carcinogenesis trajectory these tests are. Most cervical cancers can be traced to an HPV infection. However, it's important to note that not all HPV strains are linked to cancer, and not all abnormal cells found in the cervix become cancerous. We know that screening for cervical cancer works because we've seen reductions in cancer rates. The PAP is done because it's the standard testing used to find abnormal cells. Abnormal results can lead to further testing. It's important to note that a PAP test does not test for HPV, it tests for abnormal cells. An HPV test would be done independent of the PAP test. If a PAP shows abnormal results, this may lead to HPV testing. The recommendation for regular screening is for anyone with a cervix from ages 21 to 65. Where is the PAP test on the cancer trajectory? It's early because it's checking for abnormal cells. It's checking before cancer develops. This is how we prevent cervical cancers. I want to stress that not all abnormal cells found in the cervix become cancerous, and in most cases, they do not lead to cancer. Screening is recommended after age 45. However, if there is a high risk due to family history or genetic disease, screening can be recommended much sooner. There are various different ways to screen for colorectal cancer, with colonoscopy as the gold standard. It's considered the gold standard for screening because it's very effective in preventing colorectal cancer, and this test is performed every 5 to 10 years. A fecal occult blood test, or FOBT, is a test to check stool for blood that can only be seen with a microscope. A small sample of stool is placed on a special card or in a special container and returned to the doctor or lab for testing. Blood in the stool may be a sign of polyps, cancer, or other conditions. There are two types of FOBTs, and FOBTs must be done annually to be effective. Other methods of screening include a DNA stool test, a sigmoidoscopy, and a virtual colonoscopy, or CTC, which means computed tomography colonography. Colorectal cancer screening is another form of screening that can prevent cancer from developing by removing polyps and abnormal tissue before they progress to cancer. If there is cancer, catching it at an early stage can improve survival rates. Lung cancer is the leading cause of cancer deaths in the US in both men and women. It is also the most preventable cause of cancer death. Screening guidelines are for people within the ages of 55 to 77 that have a 30-pack year history. That means if you smoked a pack a day for 30 years, 2 packs a day for 15 years, or any variation that adds up to a 30-pack year history. You are a current smoker or have quit within the last 15 years and are willing to undergo treatment. People who meet this criteria qualify for lung cancer screening. The current recommended method for lung cancer screening in high risk individuals is a low dose computed tomography or low dose CT scan. This is considered the gold standard for lung cancer screening because it has been found to be the most effective method of detecting tumors before they spread. It provides a detailed image of the lungs and has been shown to reduce lung cancer deaths in heavy smokers. This test is done because it can spot the cancer in early stages before symptoms develop, allowing it to be surgically removed. Lung cancer has a high cure rate when it's found early. Once symptoms develop, it's generally too late. In the US, prostate cancer is the most common non skin cancer in people with a prostate. It is the second leading cause of cancer death in men. Prostate cancer is found mainly in older men. Although the number of men with prostate cancer is large, most who are diagnosed with it do not die from it. Prostate cancers occur more often in African Americans than in whites, and African Americans with prostate cancer are more likely to die from the disease than whites with prostate cancer. Since New Jersey has the highest incidence rate of prostate cancer in the country, it is especially important to screen. PSA testing is recommended at age 50. However, similar to other cancers, if you are at a higher risk, more frequent testing and testing at a younger age may be recommended by a healthcare provider. There are currently no routine screening standards for prostate cancer. However, these may be included in screening. A digital rectal exam is an exam of the rectum. The doctor or nurse inserts a lubricated, gloved finger into the lower part of the rectum to feel the prostate for lumps or anything else that seems unusual. A prostate-specific antigen, or PSA test, is a test that measures the level of PSA in the blood. PSA is a substance made mostly by the prostate that may be found in an increased amount in the blood of men who have prostate cancer. The level of PSA may also be high in men who have an infection or inflammation of the prostate or benign prostatic hyperplasia, also known as BPH. That's an enlarged but non-cancerous prostate. Studies are being done to find ways to make PSA testing more accurate for early cancer detection. Shared decision making is important in healthcare. However, it is especially important with prostate screening. Shared decision making is a process that involves the healthcare provider and patient having a discussion of the pros, cons, and uncertainties of screening. This really should be the standard in healthcare. It's not a one sided conversation, and since the guidelines for prostate screening are very individualized, shared decision making plays a bigger role in prostate screening than in other screenings. Studies show that there is less screening when shared decision making isn't a part of the healthcare visit. Less screening means more deaths, especially in the Black and African American community where rates of prostate cancer are higher. Screening is a procedure, and there's going to be risks with any kind of procedure. But in most cases, the benefits far outweigh the risks. Some risks include pain, bleeding, false negative or positives, and complications. For people that are on or underinsured, NJC is a great resource for cancer screening. If you meet the eligibility criteria and are in need of cancer screening, please contact NJC at 1 800 328 3838 for more information. The Screen NJ website can also provide resources on lung and colorectal cancer screening, including a search to find providers. In the following section, we will discuss controllable cancer risks. Like I mentioned earlier, genetics and age can play a role in cancer risk, but we really can't control our genes or age. However, lung and colorectal cancer deaths can be prevented with screening. Controlling or limiting certain lifestyle factors and environmental exposures can directly impact and reduce cancer risks. This section focuses on the very early part of the cancer trajectory. I prefer to think of it as before the cancer trajectory even starts. So, we just reviewed screening basics, and I want to stress again that screening is very important in reducing risks of certain cancers. We know that cancer screening saves lives. It can improve outcomes if you do find a cancer that can be treated earlier. Remember, the earlier in the cancer trajectory we screen, the more likely we are to prevent cancer in the first place. As far as diet, I don't need to tell you the benefits of a diet high in fruits and vegetables. But we do have to watch for compounds that we create when we use high heat for cooking and grilling. These include acrylamides, heterocyclic amines or HCAs, and polycyclic aromatic hydrocarbons or PCAs. We also have to watch supplementation. Taking certain antioxidants in high doses can actually increase your cancer risk, as can calcium, which in high doses can increase the risk for prostate cancer. As always, please discuss any supplementation with your healthcare provider. And just like there are compounds that can increase your cancer risk, there are compounds or phytochemicals, which are substances found in plants, that may reduce the risk of cancer. Cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, mustard greens, and kale contain glucosinolates, which may have anti cancer effects. The polyphenols and catechins in tea may have the good antioxidant effects that may help reduce the risk for cancer. There's also evidence that vitamin D can help reduce your risk for colorectal cancer. So, where do you think in the cancer trajectory diet falls? Do you remember which risk factor this would fall under? It's a sporadic or modifiable risk factor because we can generally control it. And did you know a healthy diet that regulates weight can help reduce cancer risk? Fat tissue causes inflammation in the body, increasing the risk for cancer. And when it's around the organs, it can increase the risk for breast, endometrial, liver, and pancreatic cancers, among several other cancers. Unfortunately, we are seeing obesity rates increase worldwide. It's not all bad news, though. Intentional weight loss has been seen to reduce cancer risks as high as 78%. So we know that obesity isn't a black and white issue and that there are various key drivers of obesity. Eating high amounts of high calorie foods, an obesogenic environment. Obesogenic basically means it promotes obesity. An example would be providing escalators instead of stairs, or when we don't have sidewalks, lights, or safe spaces to walk and be active. Behavior patterns like the learned behaviors of overeating, eating big family meals that become the norm, or on the opposite end, if you grew up hungry and you overcompensate with food now. We use food for socialization. How many of us have eaten something we didn't really want because it was expected, we were at a party, or out with friends? The perceptions of weight can be skewed. In some cases, it could be cultural. In other cases, there isn't a sense of what a healthy weight looks like. And finally, genetics. Some people may be wired to have bigger appetites or may have their appetites increased because of medications. By staying at a healthy weight, it can help us to fight cancer before it even gets on the cancer trajectory. Exercise isn't just to look good. We know that physical activity is good for your heart, mental state, and that it helps to reduce obesity, which we now know is linked to many cancers. But did you know that exercise may help to reduce cancer incidence and tumor growth, especially for breast and colon cancers? It reduces sex hormones like estrogen and reduces growth factors, and it reduces inflammation. Exercise helps to lower high levels of blood insulin, improve the immune system. It also alters the metabolism of bile and increases food transit time so that the GI system is exposed to fewer carcinogens. Other cancers that can be reduced with exercise are bladder, endometrial, esophageal, kidney, and stomach cancers. Exercise has also been shown to help with survival rates after cancer treatment. By exercising regularly, we're working before and in the very early stages of the cancer trajectory. Did you know that alcohol is a carcinogen? Drinking alcohol can increase your risk of cancers of the mouth, throat, esophagus, larynx, liver, and breast. The more you drink, the higher your risk, and that increases if you smoke too. Moderate drinking is okay, but keep in mind that moderate drinking is 1 drink per day for women and up to 2 drinks per day for men. And no, you can't bank them all to use in one day. That's actually considered binge drinking. It's been suggested that resveratrol in red wine has anti cancer properties. However, there is no evidence that drinking red wine reduces the risk of cancer. It's important to continually reinforce the habits that keep us off of the cancer trajectory. Speaking of habits to keep us off of the cancer trajectory, smoking is a leading cause of cancer in the United States, and being exposed to secondhand smoke also increases your risk. How many of us have met a non smoker that had lung cancer because of secondhand smoke? And it's not just lung cancer that smoking is linked to. It's also linked to several other cancers, including bladder, cervical, kidney, mouth, pancreatic, stomach, and throat cancers, and a slew of other chronic health conditions. Smoking has the greatest impact on the cancer trajectory. And when you smoke, you not only affect your own cancer risk, you also affect those around you. Viruses can also increase your risk for cancer. In most cases, there are ways to protect yourself against viruses. These include screening, testing, barriers, and vaccines. HPV has at least 12 strains that can cause cancer in men and women, including anal, cervical, penile, throat, vaginal, and vulval cancer. It's generally spread through skin to skin contact and during vaginal, anal, and oral sex. A vaccine for some of the cancerous strains is available and recommended for people ages 9 to 26. Both hepatitis B and C increase your risk for liver cancer and are a leading cause of liver cancer. Hep B is spread through infected bodily fluids. Luckily, a Hep B vaccine is available. Hepatitis C is spread through infected blood. It can also cause non Hodgkin's lymphoma. While there is no vaccine for Hep C, it is highly treatable. Epstein Barr virus is a herpes virus that's spread through saliva. An infection increases the risk of Burkitt lymphoma, some types of Hodgkin's and non Hodgkin's lymphoma, and stomach cancer. There is currently no vaccine for Epstein Barr virus. Human immunodeficiency virus, or HIV, is spread through infected semen, vaginal fluids, blood, and breast milk. While it does not cause cancer directly, researchers believe it increases the risk of cancer by damaging the immune system. HIV associated cancers include Kaposi sarcoma, non Hodgkin's and Hodgkin's lymphoma, cervical cancer, and cancers of the anus, liver, mouth, throat, and lung. Currently, there is no vaccine against HIV. The final risk factor we'll look at today is environmental exposure. What is outdoor air pollution? Outdoor air pollution is a mixture of tiny dust like particles and substances in the air. It can be man made, like fumes from vehicles or factories, smoke from burning fuels like wood or coal, and pesticide drift from agriculture. It also includes natural substances such as windblown dust and radon, which is a gas that can be found in homes and buildings. What is the cancer risk from air pollution? Well, air pollution is a cause of cancer. Tiny dust like particles, just millionths of a meter wide, called particulate matter, make up a part of air pollution. The smallest particles are linked to lung cancers. It's not fully understood how these particles can damage DNA in cells and cause cancer. Potentially, carcinogenic compounds may cause cancer through direct DNA damage or through indirect cellular or physiological effects. Remember way back when in the slide what causes cancer and chemical exposure was one of them? Chemical exposure can actually encourage tumor development by having an effect on normal cells. Here we have a relationship between chemical exposure and the tumor microenvironment. Cancer thrives when it has the right environment. I hope that in this presentation, you have a better sense of how this happens. We know that several factors can affect cancer risk. Screening can and does save lives, and by making lifestyle changes, you may be able to reduce your cancer risk. I really want you to feel empowered to advocate for your health by promoting the screening and vaccinations we have available to reduce overall cancer incidence and deaths. Please take a moment to fill out today's evaluation or use the mobile friendly QR code provided. Thank you for joining us today. If you need more information on today's webinar or on screening, please feel free to send us an email at outreach@cinj.rutgers.edu. You can also visit our website.